Hello Brain Shakers, welcome to the Brain Shakers Academy. In today's session, we are looking at the meninges. Now, what are meninges? Meninges are basically envelopes or membranes that line and cover or envelope the brain and the spinal cord. Now, there are three main important meninges that we're going to definitely be looking at. Now, I have drawn a diagram just right behind me that is going to help us in understanding what the different meninges are. So let's quickly use this diagram and then understand the three main meninges that we have in the central nervous system. So when we are looking at meninges, before we get to the meninges themselves and then the nervous tissue or the brain tissue itself, there are a number of layers on top of the different meninges. Now let's start from the top, coming downwards until we reach the cerebral cortex or the brain tissue itself. So the topmost layer that you're going to find there is obviously going to be the skin there that you obviously notice when you're coming into contact with the scalp of the head. And then just beneath that you have some subcutaneous layer, which is some fat layer there, subcutaneous. And then just beneath the subcutaneous, lying on top of the skull bones, is a layer that we are referring to as the periosteum. So that is the periosteum. It's just a layer that is lying on top of the skull bones. And this one here that looks a little bit fenestrated is what is going to be referred now to as the skull bone itself. And then from there, obviously, the inner part of the skull bone has a calvarium, which forms an inner fold before you get to the meninges themselves. So those are the layers that you will have to encounter before you can actually get to the meninges. So the meninges, in as much as their function is to protect the brain, to form a cavity as well around for the flow of the CSF, and also to support the blood vessels within the subarachnoid space, they are also covered by a number of other layers on top. Now, we did make mention that there are three main layers that we're going to be looking at, or three main meninges. But it would be important for us to understand these three main meninges, to divide them into two, meaning that we have the cranial meninges and we have the spinal meninges. Then we'll come to look at them and understand where the difference is. So we're going to basically be looking at the cranial meninges, and we will look also at the spinal meninges. Now, let's quickly begin with the cranial meninges, which are the meninges that then envelope the brain. The spinal meninges will envelope the spinal cord. The cranial meninges will envelope the brain. Now, as we look at this diagram that we have here, we did make mention also that there are three main meninges. Now, what are those three main meninges? Number one, we did make mention we were going to have the dura mater. That is our first one. And then the second one, we're going to have an arachnoid mater. The third one, we're going to have a pia mater. So this one is the one that is actually closest to the brain tissue. Now, if we were to label this diagram so that we understand which one is the dura, which one is the arachnoid, and which one is the pia mater. Important also to make mention is that the diagram here separates the meninges so that it is easier for you to understand that this is a different meninge, this is a different meninge. But in the actual sense, these meninges are actually closer to each other. And when we are looking at the cranial meninges here, we have a dura mater that has two layers. So the dura mater in the cranial meninges has two main layers, and the topmost layer is what we are referring to as the periosteal layer, which will be the layer on top here. This is what we're going to be calling the periosteal layer. So it is a periosteal layer of the dura mater, and then the one that is beneath it is what we will be referring to as the meningeal layer. So this is the meningeal layer of the dura mater. So these two then form the dura mater of the cranium. So that forms the dura mater of the cranium. So they appear separated here, but in the actual sense, they're actually closer to each other, very adjacent to each other. The only time that they are going to form space in between is when the meningeal layer, which is the layer innermost, then folds within the brain tissue to form what we refer to as septa. Now, why is it forming septa? It is forming these different septa to allow for the passage of the durovenous sinuses. Now, if you look at this particular diagram, you will see that the meningeal layer here does fold inwards, coming down here, and then creates this space in between. The space in between is in between the superior dura layer, which is the periosteal layer, and then the inferior one, which is the meningeal layer, and then creates this space. And because this is on the top part, it allows for a durovenous sinus, which we are going to refer to as the superior sagittal sinus. So this is the superior sagittal sinus. Now, do not worry about these durovenous sinuses, because I look at them in a separate video so that you can completely understand the different venous sinuses that are there within the brain system. And so make sure you're subscribed to the YouTube channel so that you don't miss any of that. Now, we did make mention that the meningeal layer will actually fold within the brain tissue to create those spaces for the durovenous sinuses. It has created one here, but that is not the only septa that is going to be formed. This is not only the only space that is going to be formed. There will be a number of them. So the different septas that are going to be formed by the meningeal layer, four commonest ones are going to be: one, you will have what we refer to as the fox cerebri, and then you will have also the fox cerebelli, and then you have the tentorium cerebelli, and then you also have the diaphragma celli. Okay, so the fox cerebri is basically separating the two hemispheres into the left and the right, and this is exactly what we are seeing here. And as it folds inside here, it creates a space for the superior sagittal sinus. Now, if you look at the fox cerebelli, so this is the cerebellum that we are looking at, and the bottom aspect, this will also separate the cerebellum into two hemispheres. Then the tentorium cerebelli is what is going to form in more transverse arrangement to separate then the cerebrum from the cerebellum. Then the diaphragma celli is what is going to form on top of on top of the sella tussica, or the hypophyseal fossa. So you have a hypophyseal fossa where the pituitary gland normally is situated. Now it forms a roof on top of that hypophyseal fossa as a fold or a septa, meaning that it then creates what we refer to as a diaphragma celli, meaning that it is going to form a roof on top of that hypophyseal fossa as a way of forming that septa. So that is your dura mater for the cranium, meaning that two layers of the cranium, cranial dura mater, and you have the periosteal, and you also have the meningeal layer that will then comprise the dura mater. Then you have the arachnoid mater. Now, the arachnoid mater is basically going to lie just beneath the dura mater. So we did make mention that this is the dura mater. So this layer now here is what we are going to call an arachnoid mater. Okay, so that will be the arachnoid mater. Second meninge from the upper part, meaning that we are coming downwards before we get to the brain tissue. So that will be your arachnoid mater. Now, from the arachnoid mater, then the next meninge that we're going to come into contact with will be referred to as the pia mater. So this is going to be referred to as the pia mater. Now, the pia mater is actually closer to the brain tissue itself, but it is not firmly attached to the brain tissue. So it's separated from the brain tissue by the end terminals of the astrocytes. Now, astrocytes are cells that have glial limitants around them, and oftentimes they are referred to as astroglial cells. Now, because they are astroglial cells, they kind of create a small space in between the pia mater and the brain tissue itself, which you are then going to refer to as a subpio space. Now, we'll be looking at the different spaces or meningeal spaces in a few seconds, but then the pia mater does not completely attach or adhere to the brain tissue, but it is separated by this tiny subpio space because of the end feet of those astrocytes. So those are the three main meninges that form the cranial meninges. You have the dura mater, double layer, arachnoid mater, and then the pia mater as well. So the arachnoid mater, one thing also suffice to mention is that the arachnoid mater is actually in close proximity with the dura mater and forms also a formidable and efficient barrier to prevent the movement now of the CSF into the subdural space, or maintaining that barrier so that now there is no space in between that CSF would actually diffuse to. That is about the arachnoid mater. Now, these are the three meninges in the cranium, but then what forms the meninges in the spinal cord? So if we get to the spinal cord, it is the same meninges that are in continuation to the spinal cord. But important to mention is that when you get to the spinal cord, the dura mater is going to be a single layer. There is not going to be a double layer when you get to the spinal cord. So if you have your spinal cord here, then you will have the pia mater that is going to be around. Then you will definitely have an arachnoid mater around. So that will be your arachnoid mater with its subarachnoid space, and then outside you will have the dura mater. Okay, so it will be a continuation of the three main meninges there, that is the dura, arachnoid, and pia mater, but without the presence of the double dura mater. Now, when we are looking at the meninges within the spinal cord, they are going to continue until they reach a level that we are going to call the L1 to about S2, which is lumbar vertebral 1 to about the sacrovertebral 2, until they reach a place that we call the conus medullaris. Okay, so when they reach an area called the conus medullaris, so then they form what is referred to as a lumbar system, and this lumbar system is going to basically be a portion from about L1 to about L2. Now, why is this lumbar system very important? It is an important site because it is a site where they would then perform a procedure called lumbar puncture to gain access into the subarachnoid space and then gain fluid, which is the CSF fluid or the cerebral spinal fluid, for microbiological, cytological, and biological analysis to try and find out if there's any problem or any infection that is actually invading the brain. And it is also an important site for the administration of analgesia, such as epidural anesthesia as well can be administered around that region, because you have nerve roots that are emanating from that region, and then the block is going to happen depending on where the anesthesia has actually been given. Now, these meninges have spaces in between them. Now, let's quickly look at the different spaces that are formed by these meninges. So you will find that the spaces are going to be, number one, we are going to look at just beneath the dura mater, you will have a space that we're going to call the subdural. So it will be a subdural space. It is just beneath the dura mater. So this space here is going to be the subdural space because it is just beneath the dura mater. And just beneath the arachnoid mater, which is this part here, you will have the subarachnoid space. Now, the subarachnoid space is a very important space because this is where now your cerebral spinal fluid is going to be located, and all manner of arteries, all manner of blood vessels, that is arteries and veins, are going to be around the subarachnoid space, which is this area here. You can see the blood vessels here that are shown on this diagram here. That will be your subarachnoid space, and meaning that that is where the cerebral spinal fluid also is going to be circulating. Now we look at the flow of CSF in another video, and so make sure you're subscribed so you do not miss any of that. And then the fourth space that we can talk about is the tiny space that we did make mention, which is the subpio space. So subpio space is a tiny space that is just made by the feet of the astrocytes. Then the fourth one is what we call an epidural space. Okay, so epidural space, it is an important area that is just on top. So epi means on top. So this is an important space, especially for the administration of epidural anesthesia, as we were looking at the lumbar system. So meaning that they would be giving that straight into the top of the dura mater. That is, if you're looking at the cranium, it will not be on top of the meningeal layer, but on top of the periosteal layer, just in between the periosteal layer and the calvarium of these skull bones. But when you're looking at the spinal cord, it will be on the outer part of the dura mater. Those are the three main meninges that comprises the cranial and the spinal meninges. You have the dura mater, that is a double layer in the cranium and a single layer in the spinal cord, and then you have the arachnoid mater and the pia mater. In terms of spaces, you have the epidural space that is above the dura mater, and then you have the subarachnoid mater just beneath the arachnoid mater, and then you will also have the subpio space, just a tiny space that is created by those astroglial cells. Now, if you found this particular video helpful in understanding the three different meninges that are there in the brain and the spinal cord and their spaces and basically what they are there for, then don't hesitate to drop your comments in the comment section. Give me a thumbs up and share as possible, and I will see you definitely in the next one. Thank you for watching.